the application of artificial intelligence in dentistry, AI in dentistry. Okay, again, there is nobody today that have not heard about artificial intelligence. I think that the concept of artificial intelligence is really on the rise, that it is now a thing that everybody is talking about. Artificial intelligence, AI here and AI there. But what exactly do we need artificial intelligence for in dentistry? So AI and machine learning algorithms are transforming clinical decision making. They are transforming our diagnostics, radiographic interpretations, and practice management. Okay, there are so many systems. If you are still a student, then your university may be incorporating the use of artificial intelligence now. I was teaching some of my students on Thursday. 2 days ago, I was teaching some of my students on how to ethically use artificial intelligence in their assignment, because during the class section, I gave them an activity to do, and very quickly somebody threw their hands up and said, "I'm done." Okay, fine. Can we have the output of what you've done? She threw at me this very neatly arranged conversation that came out of ChatGPT. The moment I said, that's quite detailed. There is no way you have done this in the few minutes that you said you've done. And then when I look at it, I can see the conversation between the student and ChatGPT over that output. And then I said, okay, it's good that you are learning how to use artificial intelligence as a student, but we need to learn the ethical use of artificial intelligence so that we can incorporate it into what we are doing. So if you're a dental practitioner, a dental technician, a dental technologist, therapist, dentist, and you are there thinking that no, you're not interested in artificial intelligence, you might be wasting your time. By the time you wake up, then people have gone far already. So we need to think about ways that we can incorporate artificial intelligence into our dental practices. Okay, so these are artificial intelligence and machine learning algorithms that can transform our clinical decision making processes. We can use artificial intelligence to transform them. We can use artificial intelligence during diagnostics. They can transform our diagnostic accuracies. Radiographic interpretations can be done again using artificial intelligence. That will eliminate a lot of human errors. And then we have practice management as well. However, is there any person here that thinks artificial intelligence does not make mistakes? Is there any person here that you think that somehow artificial intelligence will be so smart that it cannot make mistakes? The truth is that artificial intelligence can make mistakes. Okay, so you cannot learn how to be a dentist or a dental care professional based on artificial intelligence only. Okay, you can't just Google cannot teach you how to be a dentist or a dental technologist. Google cannot teach you how to do scaling and polishing or how to wax up a material and all of that. So any machine learning and algorithm driven artificial intelligence that you want to incorporate into dentistry will be to enhance your practice, not to replace what you know or what you should know as a dental practitioner. So let's look at some areas where we can incorporate artificial intelligence into what we are doing and the practices that we have now. So you can have automated dictation of caries, bone losses, and periapical lesions. Okay, so we can use artificial intelligence to automatically dictate the presence of dental caries in the mouth, the presence of bone loss and periapical lesions can also be picked up using artificial intelligence. Okay, so we have the pills, the overjets, the diagonal cuts, and all of that. These are some algorithmic kind of intelligence that we can actually use in our clinical diagnosis of dental caries, bone losses, and periapical lesions, and other things where you can also apply artificial intelligence. There is predictive analytic analytics for disease progression. So when we talk about disease progression, in dentistry we have some diseases that you can actually trace their progression. Okay, you can trace the disease progression. That is why, like, if you're talking about dental caries, there are different classes of dental caries. Okay, there are different classes of dental caries where you can actually trace the progression of the dental caries. But again, periodontal diseases, we can tell there are different classes, meaning, like, for instance, the gingivitis being the very first form of periodontal disease, bleeding gum and all of that. And then you have the higher periodontitis and all of those other forms of periodontal diseases that will come into play. So you can use artificial intelligence to actually monitor the progression with a high level of accuracy. You can use AI to monitor the progression of dental disease. And also for visual assistance in terms of charting and documentation, it is important that if you learn to incorporate the use of artificial intelligence in visual assistance, and also when you do that visual assistant when you are doing charting and documentation of dental procedures and treatment plans, that can be incorporated into that process. And smart scheduling and patient triage can also be done using artificial intelligence. If you look at if you're a YouTube person that you're always playing things on YouTube, you see a lot of adverts will start coming. Even with Facebook now, you see a lot of adverts will start coming in. One of the adverts that always come up will be like people that advertise for Monday.com. They talk about Monday.com being a platform that you can use to manage your day-to-day activities in the office. The office workflow and all of that can be managed by Monday.com, that you don't need to book appointments manually and all of that, that you can use that system to do it. So we can incorporate artificial intelligence in our dental practices and have them help us with automating some of this scheduling of appointment with the patient and all of that. For example, if you have a chart of your appointments that you are running on a day and there is a cancellation, that means once a patient has cancelled their appointment that they have at a certain time, then it means that there is a vacancy there. Now, if you have something automated that helps you to move another patient into that spot where there is vacancy, instead of you to come to work today and know that 2 of your patients have cancelled, and between this hour and that hour you're doing nothing because there is no patient there, some of the patients that are supposed to see tomorrow or you're supposed to see later can actually be moved forward, and you probably don't have to be the one to do that. If you incorporate some form of artificial intelligence in your workflow management, then they can play those roles for you in a dental practice or in a dental laboratory, wherever you are doing, and then that can improve your efficiency and productivity in your dental practice. What are the advantages of integrating artificial intelligence in your dental practice? The advantages will include consistent diagnostic support. Okay, so once you begin to use artificial intelligence in your dental practice, you can rely on the consistency in the diagnostic support that you will get out of the system. There is reduction in cognitive load on clinicians. Now, one thing about this one is a reduction in cognitive load. You think about remembering everything that you are doing. Let's say you are doing oral examination, for instance, and you have to remember what you've seen here, what you've seen there, what you've seen there, what you've seen there, and you have to remember or make sure that they are recorded by maybe your assistant and all of that. But with the incorporation of artificial intelligence, you don't really need to be the one thinking so much about trying to remember everything that you have seen in the patient mouth. The record is kept on the go as long as you integrate artificial intelligence into the system, and then you can always just go back and pull up something that you have examined or something that you've done or something that you have planned to do. You just pull it up, and then your AI integration will just call that up for you. And sometimes your AI can actually set up a reminder for you, reminding you of what you need to do next, what you need to do next. I'm not saying that you are working in a dental laboratory and you need AI to tell you now it's time to do your waxing, it's 5 minutes, you now need to off the Bunsen burner and all of those things. No, before you begin to integrate some of these technologies that we are talking about, you must know your manual practice, you must know your dentistry, you must know your work, your craftsmanship as a dental technologist. You must know it. If not, you can't learn dentistry using ChatGPT. You can't learn dentistry using dental technology using any form of artificial intelligence. These are things that you incorporate into your practice that you are already a star in. You incorporate these systems to help you to reduce the load that is on your shoulder and for improved efficiency. And these systems increase productivity and revenue. Okay, so they enhances your speed. You can do some, your turnaround can be much quicker, and most the accuracy, the level of complaint that you get from the patient dissatisfaction will drop significantly. So you can actually have improved productivity, and revenue will also go up once you begin to incorporate artificial intelligence into your systems. And it enables you to personalize treatment plans. So because you're now using artificial intelligence to look at each patient, to design treatment planning for each patient and all of that, then you can actually personalize those plans to that patient. So every patient can have a bespoke treatment plan that is meant for them. So it's no longer like one heart fits all kind of approach. Okay, how do you make a single denture? We know the process. The process is A, Y, and Z. Yeah, S, Y, and Z is the process of making a full denture, and then or a partial denture. Then you use that process for every patient. But this time around, when you incorporate assistive artificial intelligence into your practice, you might begin to see that you can actually personalize procedures for each patient, and you can be able to do that efficiently and effectively without much issues there. So what are some of the challenges that you might be facing in terms of using artificial intelligence in your practice? So this will they will require regulatory approval and clinical validation. So again, remember, you just don't practice things because they sound really good. As a practicing dental therapist, dental technologist, or dental surgeon, whatever you are practicing as actually in dentistry, you will need some form of registration, licensing, and validation to be able to do that. When you go to acquire additional skills, you need some form of validation. You need those skills to be validated. So because artificial intelligence is a new thing in dentistry, we are still working on how can this be fully integrated into dentistry. And when we are talking about full integration of artificial intelligence, we also need to look at regulations. There has to be rules and regulations on what is ethical use of artificial intelligence in dentistry and what is unethical use of artificial intelligence in dentistry as well. So it's very, very important for us to actually be open to learning these things, but that can be one of the challenges that we might be facing in the near future when we start incorporating artificial intelligence in our dental clinical practice. So integration with practice management software. So again, some of these practice management softwares might not be fully integrated with artificial intelligence. So if you have two systems running, within your practice, and then you have one software that you're using to manage your practice in terms of the workflow, or let's say the reception and administrative part of your practice is managed with one system, and now you're introducing artificial intelligence. So those systems working separately might not be fully integrated. Okay, might not be fully integrated. It's like when you are working with an device, any iPhone, iPad, they seem to be well integrated with each other, where you can use your iPhone to access information on your laptop or your iPad and vice versa. But when you try to pair your iPhone with other devices that are not from Apple, what happens? Sometimes it doesn't really work. Okay, trying to pair those devices. So that these are some kind of issues that we might encounter when we begin to fully integrate artificial intelligence into dental workflows. And you might find that some of the dental practice management softwares that we already have might not be fully integrated or incorporated with this artificial intelligence, and then that could cause some form of challenges for us to handle in dental practice. There might be concerns around the accuracy and data security with artificial intelligence. Now, it's a very big error if someone will just hands off and depend on artificial intelligence for anything. It's like when you are given an essay to do as a student, and now you go and ask ChatGPT to do the essay for you. ChatGPT can download an essay and give it to you to submit and pass. Excuse me. However, ChatGPT can make mistakes. Okay, let me tell you one example that artificial intelligence can example of mistakes that artificial intelligence can do is that the system may not be trained to check between facts and fictions. Okay, facts and fiction. How does ChatGPT work? ChatGPT works by you put in a topic, you want some output about that topic, it scans the web for you. Okay, it scans the web, everything for you. Pull with very high speed. It will pull resources together from far and wide, and then put it together for you as an output. Now, what are the problems that you can have with the use of artificial intelligence in that sense? One of the problems include that this system may not be able to check what is facts and what is fiction. Okay, it cannot differentiate between facts and fictions here. Thereby, if there is a fake news or a gossip news that is out there about something, about a topic that you are trying to write an academic piece on, the artificial intelligence might not know what is gossip and what is not fact. Pull everything together and hand it over to you. And then what happens? You carry that information running, thinking you know what you're saying, but you might just be carrying gossip, you might just be carrying fake news or false news or any of those things. So we need to be really, really mindful about what we do with our artificial intelligence integration. Now, men and brethren, I think that our time is probably up. Are you happy for me to give you an extra 10 minutes because of the time we lost?